Question 48. Which of the following is the most likely explanation for this patient's symptoms? All right, orthostatic hypotension, hypokinesis. Okay, this looks like cardiovascular maybe. Vascular, cardio, not sure. A 70-year-old man reports lightheadedness and blurry vision today when trimming tree branches in his yard. He endorses left arm pain and an episode of near-syncope while carrying groceries up the stairs. So left arm pain with loss of consciousness or close to it should be screaming the alarm bells like this guy's about to meet Jesus. This could be an MI. Don't rule out MI until proven otherwise. He walks 2 miles daily without difficulty. He had no chest pain or palpitations. Okay, so no chest pain is a little conflicting with our possible MI, but again, don't rule it out just based off of that alone. So no chest pain or palpitations during these near syncopal episodes. He denies orthopnea or leg swelling. Okay, so probably not CHF. His medical history includes hypertension and coronary artery disease. So this is the layup for the MI. On exam, he appears well. Neurologic exam is non-focal. So he appears well. He's not in pain. Neuroexam non-focal. Yeah, usually people that are having heart attacks do not appear well, but interesting. So we have the left arm pain without chest pain. So possibly an atypical presentation of MI. It's kind of hard to say. But again, some people just have epigastric pain for an MI or back pain for an MI. Which of the following is the most likely explanation? Okay, so orthostatic hypotension, probably not. That would present with loss of consciousness or near syncopal events after standing up. So we don't have anything like that. We're going to cross that off. Ventricular wall hypokinesis. Okay, so this is going to be our MI option, right? If you have an MI, some of the heart muscle dies and then it's just not going to move appropriately. So you'll see on an echo that there is hypokinesis. So it's not moving as much as it should be. So definitely keeping this at the top of our list. Transient neural ischemia. So this sounds like a TIA. Do you think he's having mini strokes? Maybe with lightheadedness, with blurry vision, but how would that explain the left arm pain? Probably would not, right? It didn't say he's weak or has sensory loss. It's just the near syncopal events. So, and specifically when he's doing things like trimming the trees or walking up a flight of stairs, carrying groceries, I guess. So I'm going to cross that one off, or at least put it lower on our list. D is large vessel stenosis. This one takes some brain power to figure out large vessel stenosis. If you're not sure about it, we'll come back to it. That's okay. Valvular incompetence. So like a regurgitation, probably not going to cause these symptoms. Arm pain with activity and then near syncopal events. I just don't really see that one being possible. So MI definitely looking juicy, but if we were between these two and we just had to guess, probably pick MI and move on. But let's go ahead and just evaluate choice D a little further. Large vessel stenosis could refer to something like this. Okay, so back to our potato drawings. This is the left ventricle aortic valve and the aorta and aortic arch. So we're going to zoom out here. We've got blood shooting through the aortic valve into the aorta, joining the aortic arch, and now we've got 3 pathways for it to go. Brachiocephalic, left common carotid, or left subclavian. Well, let's say it goes through our brachiocephalic here. And unfortunately, we have some subclavian stenosis, large vessel stenosis. Well, blood likes to move, just like traffic, through the path of least resistance. So some of it's going to make its way through here, a little bit, sure. But the majority is going to go through the right carotid. Now, how then are we going to supply this right arm? Well, let's trace this up here. The right carotid, actually, if you take a look at this racetrack I drew, it connects to the right vertebral artery through the circle of what you talking about, Willis. Now, this obviously is not exactly what it looks like, but the circle of Willis, it does connect the anterior with the posterior cerebral circulation in a similar fashion. So this blood can then come down and supply the right arm, and that's called subclavian steal. This can happen on either side so long as the stenosis is proximal to the vertebral artery inserting onto the subclavian artery. Because if your stenosis was, say, here, well, then it wouldn't make any sense. You can't steal anything because it's still blocked. So this phenomenon happens when patients are using their upper extremity more. So going back to this guy, let's take a look here. He said these near syncopal episodes occur when he's trimming tree branches in his yard. So you have to imagine if you're trimming tree branches, you've got your hands over your head. Another way they can tell you about overhead activity is if someone's a painter, right? You're painting high up above your head. You're working working overhead. And what you can imagine is if you've got the clavicle running through here, as you flex your shoulder, this subclavian artery might bend upwards and even be compressed by the clavicle. That, in combination with the sustained muscular effort it takes to hold your hands over your head, is going to seriously increase the oxygen demand of that arm. So you're going to need a lot more blood going to the arm. And so the right subclavian artery and all the arteries distal to it are going to vasodilate to get more blood there. And remember, blood moves from high to low resistance. So now your common carotids and your vertebral arteries are going to be relatively low resistance compared to your arm. So you're going to get a lot of this shunting or subclavian steal happening. Okay, but does that make sense? Does it really make sense compared to MI? Well, let's keep going. He endorses left arm pain in an episode of Near-Syncope while carrying groceries up the stairs. So again, he's doing something with that left arm. Here's the kicker. I put this in intentionally here. He walks 2 miles daily without difficulty. If this was a cardiogenic source, then it's probably less likely that he would be able to walk that distance every day without any trouble. Even with his risk factors, his hypertension, his CAD, just doesn't add up with the mileage he's putting on, right? Because when you're walking, you're not using your arms, right? They're swinging passively as opposed to holding something and going upstairs or working overhead, which can exacerbate subclavian steal. And then comes the matter of acuity, right? MI would be very acute. We don't know when these happened. Like the tree trimming was today, but when was the groceries up the stairs? We don't know that. Plus, he walks 2 miles daily without difficulty. So we don't know if this is all happening today or if this has been over time. But large vessel stenosis or subclavian steal would be more noticeable over time. It'd be less acute. But you could definitely have an acute episode like this when you start working with your arms. So that's why D has just a little more going for it. So the answer is D, large vessel stenosis or subclavian steal.